let's eat.
My name is Casey Fan, and I have 3 kids, and the oldest is in college. My day is pretty hectic, a lot going on. Let's start with this. Got homeschooling, got my work that I do on the side, plus your regular house chores, so you could say it's a full, packful day.
5, 6, 7.
Good job, Mama. Good job.
Yes. Well, when the pandemic first hit and I had to homeschool, I felt very overwhelmed. And I didn't know how I was going to do it. I started having severe anxiety attacks because I was so overwhelmed with the news and everything else that was coming out and people getting sick and worried about getting sick. My anxiety shot through the roof. And a friend of mine told me about CBD. And I put it in my tea or my coffee or under my tongue. And I would say within the first week, my nerves started to calm down. And I was able to just be able to think and come up with a plan of how I was going to do this. How was I going to manage? I definitely was surprised how CBD helped. And it tremendously helped relieve me of my anxiety during this time.
How would you say your usage? You're using more?
Yeah.
My name is Yadvinder Singh. I'm the owner of Dolly's Cannabis. In the last 2 months, I've definitely noticed new users increase coming to our store.
Okay, so it's $33.56 box.
Before, it was just anybody that was an original smoker or had used cannabis products. They were the predominant ones coming in. Now we're starting to see more and more just brand new users coming in and looking at it. The lack of social interaction is really starting to weigh on people. They don't even know if they're depressed, but they know they're not happy. People that are new to cannabis, they're kind of like a 50-50 split. Half are coming for mood and anxiety.
So we're going to do Kush Mint by Back 40.
Yeah.
One of those.
But the other half are looking at it, especially the older patients, they're coming at it for pain management. They'll tell me, you can't drink beer all the time, you can't do this all the time, that I need something to kind of get by through this time.
My name is Daniel Guedes, and I'm an art clinic student here in Toronto. I started using CBD, vaping CBD, as well as CBD oil for anxiety and relaxation, and it's been very effective so far and has helped me a lot with managing anxiety and with the part of relaxation as well. Well, it increased my anxiety, and that has negatively impacted my work because of the part of the anxiety, so it would have to be like trying to calm me down to go back to work and focus. And it also rendered me a visit to the hospital as well because of too much anxiety. So it's been very helpful because, one, the onset from the CBD is very fast. It's in a matter of a few seconds, you can start feeling the relaxation from that. The other thing is that you're still able to focus on your work. Since I started vaping and using the CBD oil, I'm feeling much better. It's like anxiety has reduced, I would say, like 95%. It's like a complete difference, like a day and night to me.
And now for a fuller picture on using cannabis, how to do it safely, we turn to Dr. Leslie Buckley, Chief of Addictions at CAMH, that's the Center for Addiction and Mental Health. So, Dr. Buckley, you hear this all the time, cannabis referred to as sort of an all-encompassing term, but it's not just one thing. So can you walk us through the difference between CBD and THC products?
You're so right, Adrienne. THC and CBD are very different, so it's important to distinguish them. THC is the really active component. That's what's responsible for the high. And THC is also responsible for the reward in cannabis. And that's the part, in addictions we know is so relevant because that's how dependency can be initiated by that reward pathway firing. CBD, on the other hand, even though it may be psychoactive, we know that it has a much more subtle impact. And it doesn't, as far as we know, impact the reward pathway. So it's not really something that people seem to get dependent on.
Okay, so if THC is the key one here, what do we know about the long-term effects of the prolonged use of it? What could we be dealing with here?
So we know that cannabis can increase anxiety and cause depression. And we know that it can also impact cognition, so cognitive difficulties, even with just once a week use, but certainly much more pronounced with heavier use. We also can see, if you're smoking cannabis, you can have lung problems. And physical coordination it can increase your risk of accidents. And it's really important not to drive when you're using cannabis.
So I hear you and I hear your concerns. I also know, this is legal. There are lots of people who say it's helping them with pain and sort of then by extension they claim it helps them with anxiety. So how do you square this circle? How do you do this safely right now, especially in the middle of this pandemic?
There's a few tips and tools for how to do that. So probably the most important one is to be careful with the amount of cannabis that you're using. So if you can limit it to weekends or, a couple of days a week, or limit it to special occasions. And that way you can protect yourself from heavier use. Also, using cannabis in daily activities can be a problem because you start to associate cannabis with everything that you do. And then you might get triggered to use cannabis when you don't want to. Avoiding daytime use is a great option. Reducing your THC content in the cannabis that you're using can really help reduce harms. And finally, if you're trying to reduce your use of cannabis, you might want to spend less time with people who are using cannabis heavily, or arrange, to be with them at times when they're not using.
Okay, this is all really helpful. Dr. Leslie Buckley, thank you.
Thank you, Adrienne.